Okay, I'm going to share some really important progress I think we're making here that I've been doing in reversing cervical fusions in general. I've had many patients come to me with multi-level, 2, 3, 4-level fusions in the neck with horrible pain after for years. And everybody tells them, well, you need more fusions. You know, it's weird that a lot of spine surgeons' answer to every fusion is more fusion. I disagree. I think we need to cut the fusion out if possible. And there's ways I assess that with a CAT scan. I remove fusions and I place artificial discs in the cervical spine. So far, I have 43 patients. I've reviewed the data very carefully, and we have statistically significant improvement in neck pain scores and visual analog pain scores and overall quality of life scores. So far it's very exciting that we're reversing fusions and converting them to disc replacement. Restorative motion surgery is what I call it. Remove the plate, cut out the fusions, and now he's got artificial discs that show full mobility and motion. And his pain scores went to 0. From a pain score of 6 to 8 out of 10 constant to 0. Notice how he has more curve in the neck because he can now set his head where he wants to, where before it was impossible to move his head. So the muscles pull all the time, trying to put him in a position that he can never be in.